Hi, my name is Patrick Traverse and I am a financial planner and a Medicare specialist for a full-service financial planning firm just outside of Charleston, South Carolina. Our firm specializes in helping families near or at retirement maximize their retirement income while being prepared for their lives what ifs. At our firm, we believe that proper Medicare planning is an important part of retirement planning. Making sure that our clients have the right coverage at the right price is our focus. But before we talk about anything else, we need to understand what Medicare is. This video is meant to give you the basics of Medicare. What is Medicare and how do I qualify? What is Medicare Part A and Part B? And what are Medicare supplemental plans? What is Medicare and how do I qualify? Medicare is the federal health insurance program for people who are 65 or older, certain young people with disabilities, and sufferers of end-stage renal disease. Medicare helps Americans who have contributed to the program during their working years pay for the high cost of healthcare. You qualify at age 65 or older if you are a U.S. citizen or a permanent legal resident. You and your spouse has worked long enough to be eligible for Social Security or railroad retirement benefits. And by the way, to qualify for Social Security, a person needs to have worked for 10 years or 40 work credits. And also, if you or your spouse is a government employee or retiree who has paid into Social Security. You might ask, what if you are 65 or older and do not qualify on your own and your spouse's work? If you do not have enough work credit to qualify for Medicare, you might have to pay for Medicare Part A premiums. If you have less than 30 work quarters, you will have to pay the maximum premiums, which were $407 in 2015. If you have worked more than 40 work credits, Medicare Part A is provided to you without the need to pay for premiums. What is Medicare Part A and Medicare Part B? In general, Part A covers hospital care. Such things as the cost of a semi-private room, meals, general nursing, hospital services, and supplies, all but the 3 first pints of blood. Medicare also covers some skilled nursing facility care, nursing home care, hospice care, and home health services. So what is Part B? Medicare Part B covers 2 types of services. Medically necessary services, which are doctor services that are needed to diagnose or treat your medical condition, and preventive services such as doctor visits and care that are done to prevent illness or detect it at an early stage. Medicare Part B also covers things like clinical research, ambulance services, durable medical equipment, and mental health care. Medicare Part B has a premium. It is $104.90 per month in 2015 for most Americans. However, single people making more than $85,000 and couples making more than $170,000 will have higher premiums. What are Medicare supplemental plans? Together, Medicare Part A and Medicare Part B pays for about 80% of most needed healthcare costs. So to help pay for the extra 20%, Americans can purchase supplemental coverage. The first way you can fill the Medicare gap is with Medicare supplement plans. To be able to apply for Medicare supplement plans, you must be enrolled in Medicare Part A and Part B. Underwriting may be required if the plan is purchased after the initial enrollment period. The plans are labeled as Plan A through N. 2 things that you need to know about Medicare supplement plans. Plans labeled by the same letter have the same coverage, so it makes it easy to shop for the best plan for you. Medicare supplement plans do not cover prescriptions, so extra coverage would be needed to pay for drug costs. Let's take a look at the Medicare Supplement Insurance Plans table. This table was conceived to help you find the plans that is right for you. If you're looking for the catalog of plans, you will find it in Plan F. It has the most coverage. It pays for Part A and Part B coinsurance, the first 3 pints of blood, Part A hospice coinsurance, skilled nursing facility coinsurance, Medicare Part A and Part B deductibles, Medicare Part B excess charges, and foreign travel emergency coverage. Researching the different plans will enable you to find the one that is just right for you. The second way you can fill the Medicare gap is with Medicare Advantage plans. Medicare Advantage plans include Medicare Part A and Part B. Some of the Medicare Advantage plans also include Part D drug plans. Underwriting may be required if you will, and you will have to get acquainted with the insurance company's preferred network. If it is an HMO network, primary care physician might be needed to see a specialist. Each Medicare Advantage plan is different, so make sure the one you choose fits your needs. The third way you can fill the Medicare gap is with Part D prescription drug coverage. To be able to apply for Medicare prescription drug coverage, you must be enrolled in Medicare Part A and Part B. Each drug plan differs by their monthly premiums, their deductibles, their formulary, and by their preferred pharmacy partner. There are 4 levels of coverage when using a prescription drug plan. You have the deductible, when of course the insured pays for the cost. Then you enter copayment or coinsurance. The insured pays for a portion of the drug cost up to a specified amount. Then you enter coverage gap, which is the 3rd level of coverage. After a certain amount has been spent by the insured, this level of coverage forces the insured to pay for a larger portion of the cost. Most insured never reaches that level. Catastrophic coverage is the final level of coverage. Once a large amount has been spent on drug costs, the insurance company steps in and pays for most of the cost. What is a drug plan's formulary? When shopping for Medicare Part D drug plan, it is important to take a look at its formulary. A plan's formulary is the list of prescription drugs that this specific plan covers. Make sure that the prescription you are taking is covered by your favorite plan and does so economically. Most plans give an advantage to the insured using generic drugs. Make sure you find out if the use of generic drugs would save you money. How and when to apply. You can first apply during the initial enrollment period, which starts 3 months before your 65th birthday month. If you are covered under a group health plan based on your current employment, you can sign up for Part A and or Part B anytime as long as you or your spouse is working. However, when group coverage ceases, you then have a period of 8 months called a special enrollment period to sign up without having to pay a late enrollment penalty. General enrollment is between January 1st and March 31st of each year. You are then able to sign up if you haven't taken the opportunity to do so during the initial or the special enrollment. There are many ways you can apply for Medicare. You can go online at socialsecurity.gov, visit your Social Security office, or call 1-800-772-1213. Once you are covered under Medicare, you can then purchase supplemental coverage through an insurance agent. I hope this video gave you the information needed to understand the basics of Medicare. For more information, please feel free to contact me at 843-284-0370, or you can send me an email at traversepatrick@gmail.com. I'm looking forward to help you.